In this video, I want to talk about what I carried with me during my acute and inpatient level 2 fieldwork as an occupational therapy student. I am in a hotel bathroom because I had an apartment fire. I talk more about that in my level 2 fieldwork vlog. But yeah, I thought it might be helpful to know. So I'm gonna start with my jacket here. I wore a scrub jacket every day because they keep it really cold in the hospital. And I just kept in my scrub jacket pockets things that I would commonly need. So I'm not gonna show you what's on here, but sticky notes. It's good to have on hand. And then I had a pen, a whiteboard marker because you have to write on patients' whiteboards, and sometimes the marker's not in there, and then just a highlighter. It's good for if you're trying to remember things on evaluations and stuff that you print out. And then a pencil. This, you might not think so, but it can be really, really helpful to have a pencil and a pen. Yeah. But make sure you have an eraser, and then there's always gloves in here because you grab gloves and then end up not needing them and you shove them in your pocket. Let's see. Yeah. And then I would carry like some Smarties or something because sometimes you'd end up working later than lunch and it would make my blood sugar low. Not like dangerously low or anything, but enough to where I would feel it. And especially if you're in PPE and hot, that cannot be good. So that way when I was out in the hallways, I could pop in some Smarties or something. And then this is the binder, or it's not a binder, it's a clipboard, that's the word, that I had. It's just from Walmart, but I cannot recommend enough a binder that has like a container. You have to manage like a bunch of slips of paper in acute care, and also like in the nursing home I would have loved this. By the way, I also have some videos about a sniff placement that I did for level 2s, but it's just so handy to have something where you can stick stuff inside so you don't drop it and you can keep track of it. So it's just a clipboard on the front, that way I can keep the papers of the patient I'm currently working with on there, and I can scribble stuff down. On the back here, I don't know how well you can see that. Let's see, let me get my face out of the way. So this is just the BIMS. It's, I wrote it on a piece of paper at Fieldwork and then used tape to almost like laminate it on there, and it's actually held up really well. I just wanted the scoring so that I could calculate the score. Yeah, because I can remember how to run it, just not score it. And so that could be really helpful with any quick tools you're using at Fieldwork. And then we have the inside here. So on this side is more stuff that I printed out and kind of laminated with tape on there. Up here we have GG coding. That's something that I used in the sniff, and here you have to kind of rate based off of this scale how independent you feel like someone is, and then give it a number. And that was especially helpful for like when I was communicating with physical therapists. Down here, I use this at the nursing home too. I was surprised because we didn't talk about this in school, but I assume other programs might. It's the KU sitting and standing scale, and I've just highlighted what's useful to make it easier on me. Then the site I was at uses the American Physical Therapy Association's guidelines as far as what lab values and vital signs you're okay to work with. So that's what I have written there. I will say the labs and vitals are like taken with a grain of salt because, for example, let's see here, potassium. we might still see somebody if their potassium is like lower than this guideline, as long as they're not too symptomatic, because often they're still standing up anyway. So like us coming to see them and moving them around isn't any more dangerous than them doing it on their own, as long as we're not like walking the hallway and stuff where they could fall, or doing anything high intensity. And like with the white blood cells, if they're really low, then they'll just be on neutropenic precautions. That doesn't mean we can't work with them. So it's just kind of to catch your attention, and then you can look up like what's the most dangerous thing, or I guess not the most dangerous thing, but like what are the symptoms of this being low or high. You can think about whether or not you feel comfortable working with that, and then you can check with their nurse. Same thing with the vitals. Generally, there's a lot of people with high blood pressure, so unless it's like really high, we will keep working with them. And like I've seen blood pressures that are like 70/50, and like we're gonna lay that person back down, but as long as it comes back up, we're not gonna call a code on them. So that can be hard. Okay, and then on the other side here in the container, I have a bunch of papers that I'll go through. So I carried this chart. I'll try to add a link below. I don't know if that'll work. This is, I've reformatted it, but this is a chart from a textbook that is, I don't know if you can see that, like deciding where somebody will go upon discharge. I actually didn't really use this because from acute care, it was just, well, either they're going home or they're going to a nursing home or inpatient rehab, and I was very familiar with those options. Yeah, it wasn't that needed, but it can be nice to have around. And then this is like something that my fieldwork educators, I think like predecessor made for the position, that I thought was really helpful. I've erased everything, but I'm still gonna put my hand here just for safety's sake. It's a chart that is the room number, the patient name, whether they get med management training from OT, when they were admitted, when they're going to be discharged, their MOCA scores, if we've done that, and then a notes column, which I made. So this is just what she would use to keep track during the meetings of like what's going on her caseload. By the way, they're in these page protectors. I just find it really helpful. That way they don't get wet or torn to shreds. It keeps them nicer. But I would just pull it out and then use a pencil to write on it and erase it. This one I did have written up nicely and in order and in a page protector, and then I lost it somewhere. And so I wrote it down on notebook paper at work, and so it is what papers will look like if you do not have them in a page protector, especially like because your hands are wet with hand sanitizer, because you have to scrub in and scrub out every time you go into a room with hand sanitizer. So this is my eval sheet of what I would ask people every time I would see them for both inpatient and acute. The way I came up with these questions is just watching my fieldwork supervisor, writing down everything that she did, and then having a printout of the evaluations, because there are certain like mandatory boxes that you need to fill in. And so like knowing what I had to get from them made filling out evaluations much quicker and easier. So for the inpatient rehab, I have up there time, because you have to write down the time you start to get their alarm, because you don't want to stand somebody up with their alarm on. It can be jarring and a bit of a fall risk. And then I will check their skin integrity when we're in the shower. I'll ask them if they drive, what they do for leisure. If they were doing their own medications, I'll check their vitals. I'll ask them if they have any goals while they're here. I'll check If they have any hearing or vision problems, I'll do a BIMS. I'll ask which is their dominant hand. I'll check their fine motor coordination, their range of motion, their manual muscle testing. I'll ask them if they're in any pain, who they live with, how many steps to get in, if they use any assistive devices, and their prior level of independence. And then I have to write the time out and to put the alarm back on. This one's a little more organized. This is the acute care. I'll write time in. I'll ask their date of birth and their name. This is part of getting their how alert and oriented they are, and then where we are right now. I'll check the alarm so I can turn it off. I'll start getting their vitals if I need to do that. I'll write down any attached equipment because that's a mandatory box. So like telemonitors, hep locks, IVs, ports, that type of thing. I'll tell them that I have some questions to ask them after introducing who OT is. Who do they live with? How much do they help? Is there help around? Is it a house or an apartment? That's a mandatory box. Do they have a tub shower or a walk-in shower? Assistive devices? How independent were they? Are they driving still? Do they have any pain? And if so, what is it? Like rating and where? That's another mandatory field. Are they right or left-handed? How many falls have they had in the last 6 months? And then after they get discharged from their hospital, what is their plan? Are we going home, somebody else's house, a nursing home, that type of thing? That can be a little bit of a sensitive question, but it's important to ask. And if I can already tell that they're gonna need therapy, I'll ask if they want to go home, how would you feel about home health? Because we have to make a discharge recommendation. And so I like to start getting a feel for that. And then I just have a list of what I would check. So I have them sit at the edge of the bed. I check their fine motor coordination, their sensation of their upper extremities, and their vision. So I'll do like visual tracking, peripheral vision. Yeah, and then if I can't get them to do anything, I aim to try to get them to take their sock on and off for me. That's lower body dressing, and you can kind of tell like what bathing might look like based off of that. And I also love to see oral hygiene because that's a lot of like vision, cognition, fine motor coordination. And then timeout and alarm. And then on here I have, it's two-sided, it's just eval form notes. So the thing with when you're in fieldwork is that the evaluation forms that you have to fill in will often have boxes with just the most random names, and what goes in them is very specific. So I'll look at a printout of my evaluators, or not, my CI's evaluations, and then I'll write like the header of each box and what goes in it, so that if I am going to fill it out and I don't know, I can look here before asking them. It speeds it up and it makes you look better. Like for example, there was a box that was participation restrictions, which that could mean a couple of things. They specifically wanted to know like what their condition is restricting them from doing, and we would write, you know, is it restricting return home, leisure, social tasks, their role, ADLs, IADLs, functional mobility, functional transfers. Yeah, and like in, there's a therapeutic activity comment, that's just the title. And in that box, you're supposed to explain why you did what GG code, and like why they were having limitations in their functional transfers and functional mobility. And I wouldn't know that unless I had it written down. This up here is old, but down at the bottom I have exactly what steps I had to check for chart review. Let's see if I can get that closer. Ooh. So I had to check if they had orders, and specifically if they had orders for where they were. As soon as they were admitted inpatient, their observation OT orders were no longer valid, so you had to be careful about that. I would check for patient notes, which is like nurses' notes that they would put in, any assessments that like PT or anyone else has done on them, any assessment reports from like the doctors, any specialist, who was consulted. Yeah. And then over here I have the goals for CRU, inpatient rehab, and these are like the same goals we would use for acute, we just use way less of them in acute. And I talked about this in my sniff video, but in school you really, like, there's a lot of stress over writing goals and them being like highly individualized and like creating new goals out of scratch. And you do have to create goals out of scratch and like tailor them to patients, but normally most people get kind of a subset, or not a subset, like a standard group of goals that all the OTs are using, because they figured out that this wording allows them to cover all of the things they like to work on with patients in this setting, because you don't want to make them too specific and then not be able to cover things that come up, because CODAs are working with them and not you, and so you can't easily make new goals. And even if you were, I think it would be a hassle to change paperwork. So for example, one of the ones in there is engage in 2 wellness or leisure activities at insert level. And so that can be like a lot of things, and you can do personalized things for that client under the goal without having to write it super specific to like, oh, we're only going to do like target practice. Or they'll demonstrate a KU sit balance of like 5 out of 5 during functional activities. And so then you can be doing a lot of things while working on that goal. So that was everything that's in my folder here and my scrub jacket. And all of this is nice, and the like sheet covers are nice because you can wipe it down with alcohol, and that way it can stay like infection friendly when you're going in and out of rooms. All right, in a different video I'm gonna go through kind of the other stuff I carried in a binder that would normally stay in my book bag, that was helpful, because I didn't want to carry a heavy binder with me everywhere I went. You're going a lot of places. I hope this was helpful, and I hope you'll check out some of the other videos to help you get ready for fieldwork if that's what you're doing, or to get an idea of what OT fieldwork is like. And thank you. I wanted to add 2 other things that I had forgotten about. So the first is this watch. And I'm gonna say this wrong, I think it's called a Maze Fit. It's a BIP 3. It's kind of like it's turned off right now. It's kind of like a smartwatch. And I did get a waterproof cover for it, but instead of being really expensive, it was only $39, which depending on your situation might be expensive for you. It was one of those things that I decided I needed to buy for fieldwork. I have 2 things that I decided to buy for fieldwork. It can tell me the time, which was very important. In acute care and inpatient rehab, you're timing your sessions all the time. Same thing with in the nursing home. And you need to write like start and stop times. And so being able to quickly tell the time is really important. It could also do like a stopwatch and a timer, which are really important. You don't want to be pulling out your phone at fieldwork, both for infection concern reasons and also because of the perception of others on you as a fieldwork student. It also might just be in your company's policy that you're not allowed to have your phone out. So having something that isn't your phone to be able to do that is great. And then I got these. I think they're technically running shoes, um, but a lot of healthcare workers use them. I got them because even though they're really expensive, a lot of people recommend them as being really good for standing on your feet all the time. Um, since then, I think I would choose a different pair um, or a different brand, but that's what I got. Because when I did my first hospital-based field work, I noticed that my feet and my hips and my back and my knees and all that hurt a lot at the end of the day because you do a lot of standing still on hard surfaces. I worked as a nursing assistant before, and so you're on your feet a lot, but you're moving around a lot. And so it's just not as hard for me. But I have very sensitive feet, and so I really splurged for something extra. They are expensive. I will say that if I did it again, would probably get Brooks, um, just because they have a 40% discount for OTs. And even though I can't use that as a fieldwork student, um, it would have been nice to try them out before having access to that discount if I'm gonna buy nice shoes anyway. Uh, they don't have to be expensive shoes. I'm just making the point of in these settings, you might be standing still a lot. In addition to all the moving and lifting, but you might want to think about getting some more supportive shoes so that you're not in pain all the time. That makes it a lot harder to do good at field work. Okay, this is actually the end. And if you're going out on field work, I wish you lots of luck, and I'm sure you'll do great.